welcome to our last event for our fall series, Virtual Tours and Tidbits. Now, if you want to ask, can you guys hear me okay? Is the audio good? The audio is good. We're solid. So we have a special treat for you today. We're featuring the SKC Nursing Department, and we are going to introduce Harmony. Harmony is a synthetic cadaver, and she is the only one here in the state of Montana. So we're pretty excited about that. But before all that, I'd like to hand it over to our Executive Director, Nick Roberts.
Hey everyone, my name is Nick Roberts. I'm the Executive Director of Salish Kootenai College Foundation. Thank you for joining us. First of all, thank you for this whole fall series as we've been playing with the virtual format. We didn't know how this would go, and it's been really successful, well received. Thank you to everyone who's given it a shot with us and been patient for some technical ups and downs, but I think we've got that dialed today. So here we are for our last event of the fall series, and before we hand it over to the star of the show, Dr. Lisa Harmon, I want to tell you a little bit about our foundation. So the SKC Foundation's main role is to do things just like this, to celebrate our people, to celebrate the impact of our programs, and to keep us all connected. You know, whether you're a current SKC student, faculty, staff, alumni, a local business, or even a supporter who's out of state, we want you to feel proud of this really special place we get to invest in together. And for those who might not be local and don't know what's happening here on campus in the Flathead Valley, I'm going to ask my cameraman Dakota to do a little panorama behind us to show us a little bit of the beauty of early winter here in the Flathead Valley.
Look at that view.
Not so bad. We send our hearts and prayers out to those of you in the wildfires on the West Coast that we know are still burning while we're here in early winter. But thank you for joining us. You've met Dakota Swank, our marketing events coordinator. I'd like to briefly ask Amanda Serrano to stand beside me. She's our scholarship coordinator. She manages all the scholarship programs that we're fortunate to have available through the foundation. And in addition to our staff, we have a volunteer board of directors who give their time and relationships and help us build the network and the impact that we can achieve together as well. So thanks to our board. So please stay connected after today. You can find us on our website, which is vision.skc.edu, Facebook or Instagram. And lastly, this very stylish face covering I'm wearing could be yours for only $10. If you want to go to our website and click the Donate Now button, just type in a $10 gift, and there as you scroll down the transaction platform, you can write a little note in the notes section that says mask. And we'll have you one here at our foundation office where you can pick it up, or we could even mail it to you if you need. So make that happen, look cool, and support this SKC community with your face. All right, without any further ado, I'm going to have Dakota follow me into the nursing department building here where we're going to meet Dr. Harmon. Who's at the top of these stairs. So I'll hand the show over to Dr. Lisa Harmon, the chair of the nursing department here at SKC. Thank you so much.
Thank you, Nick and Dakota and Amanda. Thank you for showcasing nursing today. We're really happy to see you, and we are in week 7 of this fall quarter. So it's lots of students and lots of good things going on. So thank you for joining us. So Dakota, do you want to walk down the hall and I can talk about the degree programs that SKC offers?
That's right.
Okay. So SKC, we have 2 nursing programs. Well, actually currently we have 3, but we are retiring the associate degree. So we've admitted our last class of associate degree nurses. I can point out here was the very first associate degree class, graduated in 1991. So this whole hallway, every nursing class that has ever graduated from SKC is featured in this hallway with all these pictures. So we do have an associate degree. As I said, it's being retired. The last cohort will graduate spring of 22. So we've just admitted that last cohort. Then the college also offers an RN to BSN completion program for those nurses who are already registered nurses but wish to complete their bachelor's degree. So that course, that program we offer here as well. It's mostly online, and that's a very popular major because we have a lot of nurses in this area that wish to complete their bachelor's, and we have a lot of native students throughout the state of Montana that are already working full-time and can't drive to campus. So that's a popular degree for all those working nurses who wish to complete their bachelor's. And then our brand new program that we're really excited about as well, in addition to the associate degree and our RN to BSN program, is our brand new 4-year direct admit Bachelor of Science degree in nursing. So a direct admit, that program was developed specifically so that students can come into the program and right from the very beginning, they are nursing majors. So there are some other schools and so forth that you take 2 years of gen eds and then you apply for years 3 and 4 in nursing. But we wanted a program where they start at the very beginning as a cohort. And that way they help each other out more. They're not competing for the same spots. And we are so excited about this, Dakota, because we are the first tribal college in the United States to offer a Bachelor of Science degree in nursing curriculum. So we are excited. We've admitted our first class. They're already in week 7. And we think that we're just on the move here at SKC. We have a lot of exciting things going on, great faculty, great students, and we'd like to show you some of those aspects now, if you have a minute. So I think, Dakota, maybe we'll start in the simulation lab. Okay. So simulation, I'm going to have the simulation coordinator tell you all about the purpose and the benefit of simulation. It actually started as the military model because pilots have to learn in a simulator lab before they actually get in an airplane. And that's something similar to us as nursing students. We want them to practice on a simulator before a real person. But I'm coming in here now, and I'm going to deliver you to our experts. So I'd like to introduce Kendra Reinlesoder, and she is our simulator coordinator and simulator person extraordinaire. And her very able-bodied assistant, Audrey Blood, and you will probably see her later on in this evening. But she is going to, I think there might even be a birth.
There could possibly be a delivery. We may have to recheck our patient.
So we might have an obstetrical case here, but I'm going to step out and I'm going to have Kendra demonstrate all kinds of adult things.
Excellent.
And the purpose of simulation.
Yes.
And Audrey, you'll be ready to catch the baby or whatever the term is.
Whatever. Yes. And so a disclaimer, the adults, we may want to divert the eyes of the younger viewing audience as we're about to deliver our patient.
All right, well, thank you. I'm going to be right out here waiting.
Okay, thank you, Lisa. So the simulation lab is set up to get students used to practicing on patients, and they're safer patients. So for instance, if we had an OB patient, they were wanting to see a delivery, but they'd never seen anything like this before, they may be able to come in here and we would set this patient up just as we would in the regular hospital setting. Those students would be able to do vital signs. They would be able to see how to hook the patient up to the monitor that monitors the baby's heart rate. and monitors the contraction patterns. So we would be doing that, and in the meantime, we would be waiting for this baby to be delivered. And so some of these simulators are controlled by hand. This would be one that we haven't gotten upscaled yet. We have some birthing simulators that are probably $70,000. Those models are absolutely incredible because you can actually feel the umbilical cord pulse in some of these models. It's incredible. If the baby was to get stuck, for instance, you could pull a leg up and it would actually show you if you're putting too much pressure. And this baby is just about to be born. So again, like I said, if you're in the place where you have younger children watching, this might be the time to kind of change their direction, but we're just about to have a baby. And again, we would be teaching the nurses kind of how to assist through this process. And all of a sudden that baby's head is born, and we would teach them how to just kind of assist the doctor through this process. This is normally where the doctor steps in and is sitting down at the foot of the bed. However, we do need to know as nurses how to handle these situations if we're stuck in this by ourselves. So we teach them through the process of coursework in the schoolroom, what we're worried about with the baby at this point, whether a shoulder might be hung up in there, how the baby looks on presentation. And then as this baby is being born, we're going to show different things to do or not to do. We're just going to kind of let that whole process happen on its own. Once those shoulders are born, we're kind of out of the woods. And again, this is kind of modeled to be like a very normal birth where it doesn't just like spontaneously happen. So here comes this baby. The presentation is just right. We're going to kind of stabilize the neck. And we're going to just kind of assist because this part of this type of a simulator only allows for that. So we would actually teach them how to warm and stimulate this baby. So Audrey is just going to rub this baby and dry it off, because we found that with brand newborns, they lose a lot of heat through conduction. So when they're first born, we want to dry them off as much as we can. And then Audrey, as the delivering nurse, would actually be bringing this baby after we clamped the cord. And so we're going to do this little sneaky process here to show that we're, quote unquote, clamping the cord. It's going to detach, but it's wrapped around the baby's leg here. There we go. Okay, so we're going to let that process happen and let her deliver the placenta normally. And Audrey would rush that baby over to the warmer, where we do actually have a working warmer, but it's kind of an antiquated old system. And Audrey would hook that baby up to the monitoring devices and show these students exactly what we would do in a normal birth. So Audrey's going to take over as the nursery nurse here, and she's going to work with that system. And I'll bring you over to this other simulator. This is a $100,000 simulator. So as you walk through this lab, you can see that there are differences in the technology, there are differences in the monitoring programs. This one is probably one of our more updated simulators. He's going to be about a $70,000, $80,000 simulator. And the difference between that and that is that he has very palpable pulses on his feet, so the students can get used to feeling exactly where that pedal pulse should be. And back here in my computer room, behind the double glass, I'm actually able to tell with this program whether they've really felt that pulse in the right place or not. Once they get an IV established, we can actually give medications through this tubing, and the computer programming, if they report what it is that they're giving through the IV, I can press a button that changes all of these vital signs. It's physiologically modeled. So if the medication normally raises a heart rate, it'll raise the heart rate on this monitor. If it changes the blood pressure, we'll see the blood pressure change. And then they get used to having to take their own vital signs and discuss all these things with the patient. At the same time, I'm going to show you how I work that from behind this glass, kind of like the Wizard of Oz. So I'm sitting back here behind the glass, and they're working as a team. When I speak through this microphone, I can actually speak for the patient. So for instance, if they asked if the patient was in pain, I can say, oh yeah, I've got I've got this huge pain in my chest and I can't breathe. And so at the same time, they can't see me, but I can hear them, I can watch them, I can see what their teamwork is. I'm back here writing notes, and then I'm changing the programming on this screen as it's going through. So I can make their condition worse, I can make it better, I can see that they're putting together the interventions that they need to, and I can actually change the course of that simulation every time. It's a little bit different because every group of students works together just a little bit differently. Every time they make a little bit different choices in what they prioritize and how they're caring for the patients. So it's really interesting dynamic. And after they work through this system and it's kind of set and the patient is kind of packaged up, we sit down around this table out here and we talk about what happened. So it's mostly led by the students. I'll say, well, I noticed that you did this from my notes. And I'll say, can you just explain that a little bit? And then we talk through it, and they learn through this connection of working with the patient, having muscle memory with syringes and medications. And they actually start to connect what they're learning in the classroom with what to do out in the clinical setting. It's just a brilliant idea, and the research is really backing it, that this is a really safe place for students to be able to practice nursing cares. So when they're out here working through those processes, they're actually using very realistic Pyxis systems like what we have in the hospitals. They're able to actually scan their patients' wristbands. It pulls up a profile. They're able to select what medications they'd like and have to work through these processes of whether they have allergies or whether this medication is really ordered or not. And then they actually would pull the medication, and the door opens and they have to actually go through and find the exact right medication. So it really alleviates a lot of our issues with medication errors and some different things that if they didn't have these models, they might not be as comfortable with it once they get out to the clinical setting. So then they're able to actually scan that medication, scan the patient's wristband. It all comes up on a monitor where we're tracking on this electronic medical record what medications are being given. So it's really good practice. I think Audrey was able to work through that as a student too and really excelled in that setting. Some of the models that we could use a little bit of help with are maybe our pediatric model over here. He's kind of old and antiquated. He's served his purpose here quite well. He's actually run, and don't worry about his dental condition. We'll get downstairs to work with him a little bit more. But he's actually run through a compression hose. If you look at the base of the bed, it runs all the way through there and runs through this hole in the wall. And we actually have to turn this compressor on in another room, and we have to run this box that he's run on. They have some amazing models right now that the pediatric patient can actually cry. He can respond to us in a very realistic voice. He has these amazing changes where his lips can turn blue, and the students can actually see some of these signs of pediatric patients that are really important to catch right away because they just don't seem like they're pediatric patients don't hold on for the longest time. So we try to teach our students to act really quick and work really fast with them. So those are some of the things that we do. We even have these little IO machines so that we can show the students how to put in an intraosseous IV, which goes right into the bone. So with something like that, you're actually taking a screwdriver type thing with this really gnarly looking needle, and you're actually screwing that right down directly into the bone. But as daunting as that looks, it provides that quick of an IV access to our patient. So we're giving these students very real, we would hook this up to the, tubing and everything, of course, and we teach very sterile and good practices, but all of those things are to say that with everything that we've been able to put together in this room, we're trying to give them the very best preparation to go into the healthcare field. With that being said too, we've just partnered with Providence through Great Falls and Lewiston, and we are actually going to be teaching them some cultural competence items through a USDA grant that they worked really painstakingly hard for. So they've actually provided us this other simulator over here, and we're going to be trying to link these courses to where we can be teaching simulation with this model. I think that they have one too. And she has a very realistic looking skin. There's some really neat elements that she has that none of these models have. So we're going to be coordinating those classes and just working more hand in hand with those different universities to teach them how to take care of patients in a whole way. Not just their bodies, but down into their spirit, and maybe sometimes the places that are the core root of where that illness lies. Our students do really well with that in the clinical sites. We've heard great things from all 7 or 8 of our clinical sites, where they're not just passing medications blindly, they're actually going into those rooms and they're taking the time to really get deeply into that patient's space, and they're making really big impact that way, not only on the patients that they care for, but on the staff that they're working with, because it impresses the nurses that are precepting them when they really take time and invest in a holistic type of care. So I really think that that's our highlight in the simulation lab. We try to marry all those concepts that they're learning down in the classroom with concepts up here. There have been times when I've been teaching that I've grabbed the whole class and I said, we're going to just go up and watch this delivery. Because then you're going to see every single part of this care, from the time that we hook the patient up to the monitors, to the time that we dry them off, and even give the different injections that we give after the baby is born. So those are our highlights here in Simulation Lab. Thank you so much for joining us today.
Awesome.
Mm-hmm.
Let's go find Lisa. We'll move on to our next presentation.
Well, how was the simulation?
I think it was
Very
quite
cool.
successful. We delivered a healthy female.
Oh, a female. Did you name her after me? Thank you very much, Kendra and Audrey.
You're welcome.
So Dakota, how about if we go this way?
Right.
I wanted to mention that Salish Kootenai College has graduated more Native American nurses than any other college in the United States. I think we're almost up to about 400 now.
Nice.
So we're really excited about that, because then those Native nurses can go to their communities and help improve the health of their communities and reservations. And the Indian Health Service hires a lot of our Native American nurses. So I think we're going to come in here next. I'll come in and introduce you. This is one of our skills lab for our student nurses. Oh, and look, we have some patients.
Whoa.
So I would like to introduce, first of all, Jeremy Page, who is one of our nursing faculty.
Hi.
And we have Faith Faroni, who is one of our associate degree nursing students. And Faith, I understand, is a rock star. So they are going to demonstrate a skill that Mr. Page has taught this fall, and Faith has perfected it. So I will step out of the way and hand it over to Mr. Page and Faith.
Hello, my name
Hello.
is Faith, and I'm going to be your student nurse today. How are you doing?
Hi, Faith. I'm doing well.
Good. I'm glad to hear it. Can you please tell me your name and date of birth?
Yes, my name is Jeremy Page. Date of birth is April.
Okay. Sounds good. I'm going to go ahead and wash my hands for a minimum of 20 seconds to ensure proper hand hygiene,
Thank you.
and close this privacy curtain as well. I'm going to go ahead and have you lay back on the bed, and we're going to be assessing your heart and some of your neck vessels as well, okay? All right. So first of all, I'm going to palpate your carotid artery.
Okay.
I'm going to grade it on a scale of 0 to 3 plus, 0 being absent, 3 plus being bounding, 2 plus normal, 1 plus
Okay.
30. All right?
Okay.
So I'm just going to go ahead and feel your neck here. All right, I'm going to walk around to this side. perfect. I would give that a 2+. Now I'm going to go ahead and check your jugular veins.
Okay.
I'm going to have you look up and to your right.
Okay.
All right, and then do the same on your left. Perfect. And I'm not seeing any jugular vein distension, which could be a sign of like right side heart failure. Okay.
Oh, good. That's good that it's not there.
Exactly. All right. So now I'm going to go ahead and listen to some of your heart sounds.
Okay.
I'm going to start by listening between your second intercostal space, sternally on your right side, listening to your aortic valve. Okay.
Okay.
All right. Now I'm going to go ahead and move on over and listen to your pulmonic valve.
Okay.
And this is the valve between the right ventricle of your heart and the pulmonary artery, okay?
Okay. And what are you listening for with this?
Just any altered sounds, any swooshing, any extra beats.
Okay.
You have your normal heart rhythm of lub-dub.
Oh.
So if there are any extra beats, that could tell us something. I'm going to go ahead and move down to your third intercostal space at Erb's point. And here I can hear both your lub sound and your dub sound, so S1 and S2.
Okay.
Now I'm going to go ahead and move to your tricuspid. And this is a valve between an atrium and a ventricle in your heart.
Okay.
And then in the fifth intercostal space, mid-clavicularly, I'll listen to your mitral valve.
It's a lot of verbiage to remember. How do you do it?
What was that?
It's a lot of verbiage to remember. How do you do that?
Studying.
Oh, okay.
So much studying. All right. And that all sounds good to me.
Good.
Thank you so much, Jeremy.
Thank you.
Thank you.
Thank you very much. Come again.
Now we're gonna go find Lisa. How's the audio, everyone? Is it working good? Good audio? All right, well, we're gonna move on to our next presentation. That is down here.
Yeah, but I like it right here. Because you know what I like?
Knock, knock.
Oh, hi, Dakota. You're done with the skills, and now you are ready to come. Audrey. So Audrey Flood is a past associate degree nursing student, and now she is in the RN to BSN program that I had mentioned earlier, completing. She's already a registered nurse, and now she is completing her bachelor's. So Audrey, I'm going to leave you with Dakota.
Okay.
And you can talk about, I think Audrey's going to talk a little bit about why she chose Salish Kootenai College for her associate degree and for her bachelor's.
Awesome.
So you've already delivered a baby. You've been
Yep.
very busy tonight.
Yes,
Okay,
actually,
Audrey.
I've been busy all day today.
Yeah, yes, you have, because Audrey also teaches in the lab. So she has been very busy. Okay, Audrey, I'm going to step out.
Great, thanks,
Thank
Lisa.
you.
So, yep, this is, like Lisa said, one of our other skills lab. You know, we do have some mannequins in here that we are a little bit antiquated themselves. So, eventually, I think we'd like to get, you know, a little bit more updated ones. Like Lisa mentioned, I do help teach here in the skills lab with our level 1s and level 2 students. I am also currently an RN as an as needed basis at a facility in Polson. I chose SKC in general because I'm local. I grew up here. It's close to where I live. I have kids that live here and go to school here. So traveling outside of town, like maybe all the way to Missoula or Kalispell, wasn't really feasible to me. And I think that's a very common issue with students, high school students, older non-traditional students who are from this area. They like to have a more local option, and SKC is great for that. The nursing department itself, as you can see this evening, we have a lot of opportunities to learn in skills lab and in sim. one of the highlights that I really enjoy about SKC is the smaller class size compared to, say, the bigger universities. I did attend University of Montana, and down there, you can have anywhere of hundreds of students in your class. And you may not be getting that one-on-one time and intention with your instructor. You might be unable to communicate with them on a daily basis. It may take them several days to get back to you, but not here. That's one of the great things about this program. You are able to communicate with your instructors daily. They respond to you in a timely fashion, and because the class sizes are so much smaller, you have that one-on-one time with them. And that's one of the great things about the ASN program, but it's also really good about the RN to BSN program, which I'm currently in. I'll graduate in the spring, and then I'll have my bachelor's in nursing degree. It's an online format, but even though it's an online format, it's still very in-depth. The class sizes are still small, and even though it's online, we still get to interact with our peers and our instructors in a really great way through discussion formats, presentations, and our instructors actually comment on our assignments pretty regularly. They advocate for us to do critical thinking and just broaden our perspectives in nursing. The classes range from core ones that you have to do. It ranges from evidence-based practice, research, management, leadership skills, developing those skills for when you go back out into the field as a bachelor's prepared nurse. And you can also take electives like palliative care or family care, and it gives you a little bit more range of what you could eventually do in the nursing field. One of the highlights of our program for the RN to BSN is the capstone project. They really take pride in that project here. It's a quality improvement project. Each student has to come up with a project idea to improve the quality of something in the facility they currently work. So they have to do the research for it, they have to look at the evidence, they have to look at the current practices, and then they have to implement that project where they work. And at the end of the year, they have to present their results, whether that was effective or not. And institutions and organizations are really looking for that type of project from students. So that's what kind of sets SKC RN to BSN a little bit above the other organizations and institutions, I guess. So, yeah, that's why I chose SKC. It's a great family place. The instructors really take pride in the success of their students. They go above and beyond to make sure they're successful, and they really, really do what they can to make sure that you're going to succeed.
So if you said with somebody who wanted to apply into nursing, would you recommend it? SKC?
Yes, I would recommend SKC very much so, especially for those non-traditional, maybe older students, and for, I'm a single mother. I have 3 boys, and so some of you out there might be thinking, oh, it's too difficult for me. It's really not. They go out of their way, with your classroom and your work, and personally, they take an interest in their students here to make sure that they're successful. Whereas maybe in a bigger institution, you wouldn't really get that involvement and that care. So I would definitely recommend this program.
Awesome.
Yeah.
All right. Thanks, Audrey.
You're welcome.
All right. We're going to go ahead and move on out here. We begin with Lisa.
So you got to talk to our one and only Audrey. We just adore that girl right there. Okay, so the future Dr. Blood. So we're going to walk down now. I think Dakota, and I think our last station is coming up.
Yeah, what is that?
Well, that is the synthetic human cadaver that we were very fortunate enough to have received an award, a grant award from the National Institute of Health, administered by Montana State University, but it is a synthetic human cadaver that mimics even in tensile strength of organs, the proportion, the weight, the size, everything like a human cadaver. And one of the reasons we wanted a synthetic human cadaver is A, it lasts longer, but probably even more importantly, many cultures, including some Native American tribes and other cultures, don't really, it's not part of the belief system to work on human cadavers. So this synthetic human cadaver it's probably even better because it lasts longer and everybody of every culture can have equal access to education, and that's what we strive to do here at Salish Kootenai College. And so it really helps them when they're in the clinical areas because they can see in a third dimension, three-dimensional aspect, a body, and then what does that look like if a patient has liver disease? You know, how big is the liver and how much bigger is it when it's inflamed, and the heart and so forth. And so already the students are really excited about it, and we are very excited about it. And we named her Harmony. We certainly need more Harmony in the world. So her name is Harmony. Yes, we bought a female. They are more expensive than males because they're more complicated, and I'm sure you would probably agree with that, Dakota. Anyway, so we have a female. Maybe one day we'd be fortunate enough to be able to have a male as well. Our clinical sites, I haven't mentioned those yet, but speaking of clinical, we have about 7 clinical sites now. We use, in this area, we use St. Luke's, St. Joe's in Polson, and Clark Fork Valley Hospital in Plains. We're very appreciative of those hospitals, allowing our students to have clinical there. We have Kalispell Regional Medical Center in Kalispell and both Missoula hospitals, so St. Pat's and Community Medical Center. Very grateful for those sites as well. And we just added Marcus Daly in Hamilton. So we're always looking for new clinical sites, and with our 4-year BSN, we're going to be moving into the schools because those students will have school health nursing, and we'll be moving into the community because those students will have population-focused care. So we're always looking for new clinical sites and places to send our students that they can be an asset to those facilities. But this endeavor helps get them launched. And so we'll come down here. The immersion tank, she comes in an immersion tank, just like regular cadavers. And the immersion tank with water in it weighs 1,000 pounds. So before we put the water in, maintenance had to check the floor joists, because we are on the 2nd floor, to make sure that we wouldn't end up on the 1st floor. So I'm going to come in here now to the Syndaver lab. Harmony. Oh, there's Harmony waiting, and there's Heather and Faith waiting for us too. Hi. So I want to introduce you to our, I would call them fabulous and amazing, anatomy and physiology lab and didactic instructors. Heather also teaches, she's full-time nursing faculty. And then Faith Burns, we're very delighted to have her, and she is our anatomy and physiology lab person. So I'm Heather Dawson and Faith Burns and Harmony.
Yay! She's so special, and we're so excited that we get to share her with you. So I want to take you for a little tour inside her abdominal cavity, but before we do that, I just wanted to share with you how Harmony came to be. So when we decided we were going to the direct admit BSN program, we had to do a significant curriculum revision, and one of the things that we wanted to recreate our anatomy and physiology course with a clinical bend to it. And so as we kind of went through revising this course, we got to the point where we realized that we needed to have something for the students to dissect, so that they could really have that hands-on experience. When you're trying to learn the amount of information that students are required to learn in an anatomy and physiology class, having multiple ways of learning really helps the process. So we have several students. We have, more than several. We have many students that that either come from a tradition or have cultural things that preclude them from using a human cadaver, and so that kind of left us in a bind. We thought about all of our different options, and I knew that I couldn't go home and look at my kitty every night if we had to dissect them. So we needed another answer, and Dr. Harmon came back a couple of days later and had this beautiful glossy pamphlet with a Sindaver on it. And she said, I am going to get this for our students. And then she did. That's the really amazing part. She was able to get this through grant funds, and grant funds are very difficult to come by. The grant fund that she was able to access was through the NIH. So that was really amazing. And I'm telling you this story because it's really indicative of the education here at SKC. So what you see from that story is that our goal is to be very student-centered, to deliver culturally congruent education, and to have a commitment to quality education. And not only is Dr. Harmon like that, but every faculty member in our department has that commitment. So I wanted to tell you that story for that reason. Okay, so now let's get to what you are really here to see. So I'm pulling back the abdominal muscles. And well, actually, let's look at some of the outside muscles before we open her abdominal cavity. Faith, do you want to show us?
Sure. So there's over 600 muscles in the human body. And as you can imagine, having to learn all the names as well as the origin and insertion of each muscle. For example, this is the sartorius muscle right here. It originates in the hip and descends all the way down to the tibia, or the lower leg bone here. So this direct hands-on experience, and the tissues actually, they feel like muscles. So Harmony has been such a great learning tool for the muscles as well as the organs. And
Yeah,
did
so
you want to
that's
open
what-
her up
yeah.
then? Yeah.
So that is the other thing that is so special about Harmony, is that her tissues were designed to feel like human tissues. So it's really a benefit to the students to have this experience of getting to touch and learn through another, besides reading and talking. So being able to touch it, and that is particularly important when you're going to be when you graduate dealing with humans. You need to really know what you're feeling. Okay, so the first thing, so I pull back the abdominal muscles, and then I'm going to show you this yellow layer here. This is called the omentum. And the omentum, it has lymph vessels in it, it has blood vessels in it, and part of its job is to nourish the intestines. So let's just take a look overall here. So I'm going to start off with the biggest thing that we see, and this is, let's see if we can get it out here. This is the liver. The liver is really like the unsung hero of the body because it does a lot of jobs. So we know that a lot of people know that it detoxifies our blood, and but it also creates proteins. And an example of a couple of important proteins that it makes immunoglobulins, which helps with our immune system, and then it makes clotting factors. So if you were to find yourself in an unfortunate situation and be hemorrhaging, the clotting factors the liver makes will be helping you to stop the bleeding. But what's also interesting is that on the other side of the liver, here's that gallbladder. So when after a meal, it looks like this, and it's kind of flat and like an empty sac, and it's up against the liver. But before you've eaten, it's as big as a pear, and it's full of bile. And that bile's job is to break down our fats. So a lot of people have this removed because they get some problem with gallstones or something like that. And so they may have that removed, and they might have to watch the amount of fats they eat in their diet because of that. So let's put that aside. I love the liver, but I have more organs that I just love in here. So here we are looking at, this is the pancreas, and the pancreas makes insulin. And so that's, it does other important jobs too, but that's what it's usually known for. Then, if you can get down in here, it's a little bit hard to see. We can pull it out just a little bit, but this is our stomach. And the stomach is really just a big pit of acid in the center of your body. And it's got that acid in there in order to fight germs, to kill the germs before they get into your intestines, and to start breaking down our food. And so because you've got this big pit of acid in the center of your being, the stomach has to replace its inner cells every 4 to 5 days. So that's pretty neat. Back here you can kind of see, if you take a larger look, here's her spine. And then this is a very large vein there, but that's not what I really want to show you. I really want to show you this set of intestines here. And they're really quite amazing. If I were to pull this out and stretch it all out, it'd be like 18 to 23 feet long. Wow. Yeah. So the reason it has to be that long is because the more contact the food has with the intestine, the more the nutrients are able to be absorbed. So that's pretty neat. And then we can see the small intestines empty out into the large intestine. And the job of the large intestine is to pull water out of what's in there. And that helps make things come out all right. So let's keep going here. So there you can again see that large intestine. You can again see the spine. And then here is her uterus. And then she's got fallopian tubes and ovaries. And then down here is her bladder. So it's usually a little lower than people anticipate that it will be. So let's keep going here. So we have not dissected this area yet, the thoracic cavity. And the reason we haven't is because we want to save that experience for the students. So we can kind of hold it open and show you, like there's the diaphragm. Faith, do you want to talk to us about the diaphragm?
So this muscle right here, the sheet-like muscle, is the diaphragm, the major player in our breathing. And the heart sits on the diaphragm right here and nestled in between the lungs. So we have the right and the left lung. You can see that the heart has all the vessels, and once again the veins are blue and the arteries are red, although in the human body they're not exactly blue.
But they're a different color.
They are.
Yeah.
They're dark. The blood is darker within the veins, the less oxygenated blood. That is correct.
Yeah, so the veins bring back blood to the heart to get out to the lungs so it can be oxygenated. So it does look a little different whether they are oxygenated or not. Right. But not to this degree. This is a learning tool.
So the trachea, which descends down into the lungs, right here. One really cool thing about Harmony is she can actually be intubated, or we can put a breathing tube down her throat, and her lungs will inflate and deflate. So that will be a great experience for the students to practice.
Yeah. That's really special. So yeah, so that's just like an overview of some of the neat things about Harmony. We use her in addition to, we have skeletons that they can see the bones a little more clearly, but we can kind of show the students where the bones are underneath the muscles, so it gives them that big picture experience. And that's really important because no body part works alone. They all contribute to homeostasis, we call it, but it kind of helps
balance, right? Yeah.
Balance in the human body.
Yeah.
So thank you guys for coming. We really appreciate your attention. And we're just so grateful that we have this, and we are so excited to share with others.
I think we had a question on there. Someone asked about the maintenance.
Oh, that's a great question. It's a really big deal.
Yes.
So we, you may have seen me spraying the syndaver, and that's because these lifelike human tissues, they need to be kept moist. And so at night, she goes to bed in kind of a bath. And tell us a little bit about that.
Okay. So, at night we put her down into the tub
This
here.
here lowers.
This lowers, and
Like, let's see if I can do it.
she's kept in what is the equivalent of hot tub
You have to
chemicals.
really crank, so I might not be able to do it in a timely manner, but it slowly lowers.
Slowly lowers.
Yeah.
Maybe here.
You can do a little bit. There we go. She's putting some muscle into it. All right. So yeah, so now you can start seeing there the water, and this is like a chemical bath, and it keeps germs from growing on her. We can just leave it there, I think.
Leave it there. Okay.
And it kind of helps those muscles and everything retain their integrity so that it can be used for many years. And then we have to change that water periodically. They want it done every 2 weeks.
Right.
And so we give her little spa treatment every 2 weeks.
We don't want her to get a fungal infection or bacterial infection.
Yeah, so just like a human, she can
Yeah.
get infected.
Yeah.
Amazing.
Yeah. Any other questions or?
I think that was the only one. Yeah. I think we're ready to wrap up.
Ladies, thank you so much.
Thank you.
Yeah. Thank you.
Dakota, I'll have you follow me. Dr. Harmon and I are going to walk us out. And close
Thanks,
up
you
shop.
extraordinary people.
It was incredible. So, to all of our viewers and listeners who didn't see the front end, this is our last. We'll keep walking here and end up out front. Our last of our fall series of Tours and Tidbits. Dr. Harmon and team are the perfect in Harmony.
Don't forget Harmony.
Sorry, Harmony, are the perfect way to wrap up this fall series. We couldn't be more grateful as a foundation, as our goal is to continue to expose you to who we are, what we do, celebrate our people and our program's impact, which is what this is. And I'm going to have us keep walking even further, because those, while we still have some daylight, those who may be joining us from out of town or out of state, I want them to get a glimpse of the special campus we're on and where we get to do our work. Wow, we have greeters.
Well, yes, we are all here to say goodbye. And as you leave our nursing building, and we can see John Peter Paul, who the building was named after, up there on the wall. We appreciate the foundation honoring us. So thank you, Nick. Thank you, Dakota. And we will say goodbye.
Okay, thank you.
It's
Lisa.
our pleasure. Well, thank you so much. We have someone knocking down here. Maybe we'll just wrap up for a moment right here. But so as a close, often what we say at the foundation is your support can help people, it can help programs, it can help facilities, which we saw all of those things happen today. Harmony is not cheap, literally anyway. Figuratively it might be. In fact, if you want to know more about how you can support programs like these, or our scholarship program, or any of our facility work that we're doing with the foundation and on campus, please find us on vision.skc.edu, or check us out on Facebook or Instagram. So with that, and again, I do want to catch a glimpse here of the beautiful winter scenery that we've been gifted here in late October as a reminder of where we get to live and work. We'll sign off from the Flathead Valley and invite you to come back in the winter and spring quarters as we anticipate doing yet another series of Tours and Tidbits. Stay in touch and we'll do the same. Take care.